Good morning, and thank you for joining us for All Things Heart. I'm Alexis Del Cid. We are working hard to bring you some pretty incredible shows this coming fall. Until then, we'll be sharing some encore presentations of our favorite episodes every Thursday morning at 10 a.m. all summer long. So sit back and enjoy this best of All Things Heart.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It is Thursday, February 17th. I'm Alexis Del Cid, and welcome to All Things Heart. Every Thursday at 10 a.m., we're going to give you direct access to your doctors to ask any heart-related questions you might have. Today on All Things Heart, we have a fantastic program for you. We're talking about the impact of COVID on your heart, and you're going to meet two women who got COVID almost 2 years ago at the start of the pandemic, and you're going to learn the enormous heart struggles they still face every single day. You'll also hear from a cardiologist, along with a doctor in our long haul clinic on the warning signs of heart issues post-COVID. And if you have a question or simply a comment, you can share all those. Ask your questions directly to our doctors on our Facebook Live or on our YouTube channel, wherever you're watching right now. Or you can email us questions at allthingsheart@kumc.edu. We want to welcome Dr. Dana Hawkinson to our program as well, along with cardiologist Dr. Rigoberto Ramirez to All Things Heart. Dr. Ramirez, we're going to get to you in just a moment. We want to start with Dr. Hawkinson, who so many of you know from the morning medical update with Jess Lovell. Dr. Hawkinson, if you're new to the program and our shows, is the Medical Director of Infection and Prevention and Control here at the University of Kansas Health System. So we want to start things off, Dr. Hawkinson, with the latest on our COVID numbers today.
Yeah, we know the COVID hospitalizations have gone down again throughout the nation. We know this. Cases have peaked and gone down. Hospitalizations have subsequently followed and gone down. We have about 58 active infections here in the hospital today, quite considerably from a couple weeks ago when we were nearing 100 active infections. But we still are seeing the results of those cases. Even though they are dropping, we are still seeing some of those results. We know hospitalizations follow cases by 10 to 14 days. Unfortunately, we also know deaths follow hospitalizations by another 10 to 14 days. And unfortunately, in the months of January and so far in February 2022, we've had a lot of deaths here at the health system due to COVID.
It's not what anyone wants to hear.
No.
We do have questions already coming in for you, Dr. Hawkinson and Dr. Ramirez, when it comes to heart-related COVID. But we want to introduce you to two very special guests because we are now 2 years into this pandemic. And for the two women that you're about to meet, it is a very loaded milestone. They were among the first to get sick here in Kansas City, and 2 years later, they're still sick with lingering, often debilitating heart problems, health problems, all related to a nervous system disorder called POTS. Terry Allen and Michaela Dreyer have never met, but they share something big in common that they wish they didn't.
I was 29 years old, and I had no pre-existing conditions. I'd never needed medication for my body.
I was tip-top, super healthy person.
Both Kansas City women were among the first wave of Americans to catch COVID in March of 2020. And almost 2 years later, they're still sick.
I worked out in the pool twice, but I'm so fatigued after, days of sleep. I usually will sleep 2 or 3 days.
And both Terry and Michaela have been diagnosed with a post-viral central nervous system disorder called postural orthostatic tachycardia syndrome, commonly called POTS. Among the symptoms, debilitating weakness and frightening heart pounding. Terry had an episode during one of our interviews and had to call 911.
Hold on, my heart rate's going up. Can I pause this for a minute?
Another thing they both have in common, neither woman ever dreamed something like this could happen to her.
I didn't have any pre-existing conditions. I didn't have any reason for my blood pressure to be skyrocketing. I didn't have any reason for my heart rate to be out of control.
Yet here they are, still fighting tooth and nail to get back to the healthy lives they enjoyed before the virus.
There's the line that you double tap if you feel something.
Wondering when that day will come. We want to introduce you to our virtual guests now so we can all meet them face to face, so to speak, in this new age of virtual. We have Dr. Jennifer McCrae, who works with COVID long haulers here at the University of Kansas Health System. We have Michaela and Terry, who you just met in our story about them. I want to start with Michaela and Terry. First, Terry, that was so frightening when you had that episode during our first interview together. How did that wind up, and how are you doing today?
I'm sorry.
No
that
problem.
Wound up. That's when I found out that my heart rate goes up and my blood pressure drops. That was my fourth incident like that at home, and I usually we don't go to the hospital. We just kind of wait for me to feel better. But that time, thanks to you, Alexis is actually who had to contact 911 for me. The paramedics had been to my house before, and so they were like, you really should probably go to the hospital this time to find out what's going on. And that's how I found out.
And have you had an episode like that since that happened when we were on the phone?
Close to, but now they have some medication for me, so I take my medication. Feel it kind of coming on, and I grab some water, or as you see, I keep Pedialyte. I was drinking Pedialyte in that video, so it didn't happen. So I try to stay up on my new medications and drink my Pedialyte and water.
I'm so glad you're okay. It was such a relief for all of us to finally get that call from you later on that day.
Scary.
It was very scary. It was scary to watch. I can't imagine what it was like for you. I want to talk to Michaela now, because Michaela, I was talking to you a couple of days ago. You said you got some really rough news that this is so weird sounding and just really unfortunate. You might never be able to take another hot shower or hot bath again because of what it does to your nervous system.
Yeah, this is something I learned when it happened. Like Terry was just saying, with POTS, a lot of times when these episodes happen, your heart rate will skyrocket and your blood pressure will drop. And one thing that's super common with POTS is heat. So heat or humidity, just like what you would have in a hot shower, expands the blood vessels, which then means your heart has to work harder in order to keep you standing, basically. So my heart starts pumping really fast and my blood pressure drops. And I've had 2 fainting episodes in the shower now.
Oh my gosh.
And that's how I learned that heat is, well, I already knew heat was not a good thing for me, but I can't do hot showers because when you're in a shower, you're standing up and you're hot. The combination of those things does not do well for my heart. So,
honestly, on a day like today, when it's freezing cold outside, the thought of jumping in a cold shower is probably the last thing you want to do. I want to bring in Dr. McCrae, who has extensive experience working with long haulers. First of all, Doctor, can you explain to us what exactly is POTS? Because so many of us had never even heard of POTS before until we started hearing of long haul patients being diagnosed with it.
So, So POTS is a dysfunction of the autonomic nervous system. So the part of our body that does fight or flight. And so it controls heart rate, it controls breathing, it controls the GI system. And for some reason in long haulers, COVID somehow affects that system and puts it into disarray. And so we see patients come into our long haul clinic who've been having palpitations, pounding heart, lightheadedness, dizziness, and they can't really tolerate activity. So people who are healthy and fit, like both of these women who then can't do the things that they were able to do pre-COVID. And that's hard, especially because I think our tendency, we want to try to make ourselves better by exercising, thinking that that's going to help. But it's really difficult because then the heart rate shoots up and the blood pressure goes down.
Oh my gosh. And we want to also acknowledge Dr. McCrae, you're doing telehealth this morning because when weather hits, doctors don't stop working, and so a lot of your long haul patients are seeing you via telehealth. So thank you for making time to also let us telehealth in with you for this episode. We really appreciate it. Based on what you said, I want to bring in our cardiologist, Dr. Ramirez. Is this something that was completely dumbfounding to you once you started seeing long haul patients with POTS? I mean, until this point, how many POTS patients had you started seeing?
So, you know, in my specialty, I'm the specialist in terms of the autonomic disorders. So I am in charge of doing the tilt table tests that diagnose the POTS syndrome. So I would see more of POTS and autonomic dysfunction than probably the normal, physician population. But what I thought was very interesting was that, I certainly did not expect to see, the number of patients I did with POTS syndrome or POTS symptoms even 2 to 3 months following their COVID infections. And what I thought was most interesting was a lot of these patients, may not have had the severe symptoms of COVID, may have had even just a, kind of the lingering minor symptoms, but they just never recovered. And in fact, sometimes they just started to have more of the elevated heart rates, the lightheadedness, the dizziness, and the extreme fatigue, which is what, Michaela and Terry have, described today.
So scary. And I could see you nodding your head as Dr. McRae was describing, Dr. Hawkinson. I know that you're in agreement hearing this as the infectious disease, though, specialist. I mean, you're the guy we go to for all things infectious disease. Does this surprise you to hear that that COVID has had this effect on patients?
I think everything we learn about COVID, about SARS-CoV-2, continues to be surprising. We've been dealing with this now for 2 years. We continue to get better evidence, better information about what happens during the acute infection when you are acutely ill. But then now we also have better information about what happens up to a year out. And we know that there was just a large study published from about VA patients in Nature Medicine that showed the long-term consequences, even a year out, of heart problems. Dysrhythmias, meaning your heart doesn't beat correctly. There can be the heart muscle can be affected as well, so it doesn't beat as efficiently. We know that you can continue to have blood clotting disorders. All of these things, even a year out, people are suffering from these things. So it is vitally important to understand these things, that it's not just a cold where you're sick for a few days, but they can have very long-lasting effects. And this is what our guests are telling us.
And even more jarring, I think, also from what you said and from what Dr. Ramirez you're saying, is these patients aren't even necessarily the ones that are the sickest of the sick initially. They feel rotten for a week, and then comes the really bad heart stuff.
That's exactly right. And so, in fact, I think early on when we had several patients coming through, I think one of the biggest frustrations is that POTS within itself, or those symptoms, are frustrating for patients, because a lot of the treatments, as you'll hear many doctors say, it's supportive care measures. Stay hydrated, sleep well, try to get some exercise. The problem is that it's hard to do those things when you feel terrible, right? And so convincing and educating patients about the fact that those are part of it, but also understanding that, they're not only dealing with the anxiety of just being diagnosed with COVID recently, but the fact that, they feel like there's just an unknown to this whole virus. And so being able to educate them, talk to them through it, really helps and goes a long way.
That's what Terry and Michaela have said, is finding doctors that can talk to them like this is so important. Terry, when Dr. Ramirez is talking about fitness, I want to ask you a question, because Terry Allen, for those of you watching, if you might have recognized her, she's a fitness instructor. She was on Better Kansas City almost every week with me when I hosted that show. She is a personal trainer, a nutritionist. She's now a chef. Have you been able to reclaim any of that, any of your passions and your profession since getting sick?
No fitness stuff at all. I taught a kickboxing class in March 2020 on a Friday, and Wednesday the next Wednesday I was sick with COVID. Haven't been able to teach any of my classes or anything since.
So your life is on hold as you wait to see if you're going to feel any better.
That part of my life is I was also in culinary school, so I was able to finish culinary school online, and so I'm cooking and catering part-time.
Michaela, we saw some images of you, and I'm going to ask Terry about this too, about you going through your therapies to try to get through this unbelievable journey you're on. What exactly is happening during those physical therapies? What are you doing? And maybe Dr. McRae can also jump in to how does the physical therapy help your heart and your POTS?
So the physical therapy is kind of designed to help retrain the autonomic nervous system. This is how it was explained to me, at least. Dr. McRae can correct me if I'm wrong. But so basically for my physical therapy, when I started, all of my exercises were done while I was laying down in a totally supine position. And then basically what we're trying to teach the body is that you can put stress or exertion, put that out without having to have these exaggerated responses that come along with POTS. And so then gradually over time, we started moving from that supine position up into a seated position and then eventually standing, so that my body could learn better to kind of manage that fight or flight response that kind of kicks in. So I did 4 months of physical therapy twice a week. And I made a lot of progress with that. But it's something that I'm supposed to be doing forever, essentially, to maintain the recovery that I've been able to get to so far, which is about 75%-ish, which is a very rough estimate. So
75%-ish. And meanwhile, you can hear little kids in the background of Michaela's Zoom call. I mean, these are wives, moms, businesswomen, people who have a life to lead other than just dedicating it to recovery. Dr. McRae, is POTS curable, or is this a thing that Terry and Michaela and other people suffering from this will have to learn how to navigate around?
I think POTS as triggered by COVID, I don't know. I have a handful of POTS patients with other comorbid illnesses like hypermobile Ehlers-Danlos and things like that, where it's a permanent condition and we just figure out how to work around it with, I tell my patients too, exercise by laying on the floor, Pilates is great, even just kind of calisthenics and raising your arms up and down. Talk a lot about exercise where you don't let the heart rate get too fast and know, maybe you were able to run before and run 5 miles, but now it's like, you can just walk 5 minutes. And so those patients that I've seen with kind of longstanding POTS, fluid is really important. And we know in the summer months that when it's hot outside, you have to be really careful about their symptoms because they can get very, very symptomatic and have a flare. I'm hopeful, very hopeful that with the patients who get triggered by this through POTS by COVID, because they didn't have this before, that hopefully the autonomic nervous system can heal and that they can kind of get back to where they were before. I've had some long haulers who had like the 18-month mark, some of the symptoms of fatigue and brain fog and things like that have resolved. And so I'm I guess optimistic, but we just don't have the long-term data yet.
Boy, it's hopeful to hear that things are improving. I wanted to ask Dr. Hawkinson and Dr. Ramirez, are you seeing other heart issues in addition to POTS, or is POTS the predominant issue that you're seeing post-COVID patients come in with?
Yeah, so it's a very good question. So the majority of patients that I am seeing in our cardiology clinic is they're dealing with issues with constant tachycardias or shortness of breath with activities that they would previously had no problem with. And the fatigue, and those are predominantly the issues that we're seeing in terms of symptomatic issues. When that comes up, there's always these questions, they talk about, and a lot of patients have concerns about whether they have this myocarditis, because this is always a very popular topic that's out there. I think the important thing to understand is that myocarditis is extremely rare, okay?
Right.
Even in COVID patients, potentially there's a slightly higher uptake in it, but still, you're talking about 1 in millions of patients that could potentially have myocarditis. Now, the challenge is that myocarditis, it presents very similar to what the patients are already presenting with when they come in and see me. And so the workup, it tends to be a very similar workup for both of them. So certainly you listen to the patient, you listen to symptoms, a lot of these symptoms being the extensive fatigue, the tachycardia. And at that point, even with basic testing like an echocardiogram, you could get a lot of information that may help us move past that concern and that anxiety related to myocarditis, or potentially tell us whether we need to do further testing.
One of the weirdest things, Dr. Hawkinson, is when we see these people who are so healthy. They're Michaela, picture of health. She said that she'd never even been on a medication, prescription medication, until she was diagnosed with this. Terry, fitness instructor. So often in your work, you're dealing with people who are already facing a medical battle, but how many new people then are you seeing who are perfectly healthy like Terry and Michaela?
Yeah, I mean, we've heard this story. This is not unique to them. Unfortunately, there are a lot of young, otherwise healthy people who suffer from this, who suffer from bad acute infection, severe acute infection, even death, but also continue to suffer from these long-term consequences as well. And I think this is just the nature of this new virus that has never been seen by the human population before 2 years ago. And we are learning how, as a population, but also individually, how our immune system is functioning to help resolve that infection. And unfortunately, we know that the immune system can go awry and can have that cytokine storm, and it can cause these long-term effects. We still don't know the etiology and the reason that we continue to have these long-term effects. There's probably multiple reasons, but this is just a consequence of what we're seeing. And unfortunately, like we said, it's also involving otherwise healthy people who it should not be affecting in this way.
I want to get to our community questions now because my phone has been buzzing, which is always a good sign because it means we're about to give our viewers direct access to our doctors and our patients. But we actually have a question for Terry coming right in from Denise. Terry, Michaela said she's at 75%. What percentage would you give yourself right now?
5% as well. And I don't know if it is for you, Michaela, but some weeks it's up and down. Some weeks I feel great and I'm like, yeah, I'm moving along. And then the next week I'm sleeping again 12 hours a day and I'm exhausted. But overall, I would say about 75%.
I have a question from Melissa who writes, my husband has AFib and was hospitalized from COVID before the vaccine was available. He is 3 months out from his booster. Is he supposed to get another one now, or is it just the immunocompromised, Dr. Hawkinson?
Yeah, right now he would not meet that definition of immunocompromised. So right now the only recommendation for additional dosing is for that first booster. And that first booster should occur about 5 to 6 months after the second dose. So right now he should be fine. We are continuing to evaluate the data. We are waiting for it to come in. Again, I said before, Israel has produced the earliest amount of data. They have a good health system there. So we are waiting for them. We'll also be waiting for our colleagues from the VA and really anybody else to evaluate, do we need fourth dosing for immunocompromised? However, right now, really that third dose, that booster dose, should be sufficient.
Alice Dyer Hall has a question for Dr. Ramirez. Is it neurological damage or heart damage, or is it both?
Very good question. So essentially the way that I look at it is that what happens during COVID is you get a reset of both, your autonomic your nervous system, and also you get a reset of your heart rate and blood pressures. And so what happens is your body then spends, the rest of the recovery time to try to get back to that normal, that normal stable baseline for you, okay? So it's hard to say which one it is. I think that as we know now, it is a multi-organ, the multi-systems are involved, and it probably affects both systems in different ways, but as you can see, the symptoms are clear.
Dr. Hawkinson, you want to add something?
Yeah, and I think we should also be clear too, we also don't have a lot of evidence that the virus actually infects the nervous system itself. Certainly we've seen some autopsy studies and some other basic science research that maybe shows there might be minimal invasion of the virus into those nerve cells, but we haven't seen a lot of neurotropism, meaning it affects and it infects the nervous system itself. We know that when people lose their sense of smell, it's not because those olfactory nerves are infected, but it's really those supportive cells around it that get infected and damaged. So, but we are still trying to learn a lot about the pathology of this infection.
Carrie has a question for Dr. McCrae. Carrie would like to know, what are some of the key indicators of POTS, and what should you do if you think you have POTS?
So patients typically talk about really fast kind of pounding heart rate. It's often positional, so going from laying down to sitting up or sitting up to standing. And then that's accompanied with like dizziness, lightheadedness, feeling like you're going to pass out, both from the fast heart rate and then the subsequent drop in blood pressure. Also just really associated with fatigue. The fast heart rate can even occur when you're sitting down, laying down, resting, watching television, things like that. So it's not only with exertion or positional changes. Exercise intolerance, I mean, and even just like going up and down the stairs intolerance, trying to do your laundry, those sorts of things can make people very, very symptomatic. Those are the primary things. And then also, like Michaela said, worsened by heat. And then fluid helps, and increased salt helps, but sometimes the GI system can also get slowed down because part of the body, if you're fight or flight, the GI system normally gets slowed down so you can shunt the blood to the other organs to help you run away from whatever's chasing you. And so sometimes it's hard to drink that much water if your GI system is also kind of slow. And so that can be really difficult for some people. If you have a lot of nausea and things like that, that can be a sign of some of this autonomic dysfunction as well.
Michaela, you were nodding your head when Dr. McRae was talking about the not being able to go up and down the stairs and do things like that. I mean, I can't think of a worse punishment for Michaela or Terry to not be able to do physical things. You ladies were so active.
Yeah, absolutely.
Absolutely.
What a
For
bummer.
me,
Now,
I have in-building laundry downstairs, so I have to do laundry by going up and down the stairs, and it's the hardest part of my life right now. Not only because of small children and the amount of laundry that has to get done, but also because going up and down those stairs, over and over again, is totally draining. So I've relied a lot on support from friends to come take my laundry and do it for me, so I don't have to bother.
how are you able to do that with children? Oh, go on, Dr. McRae.
I was just sorry, I realized I didn't answer the what should you do if you think you have POTS?
Yes, what should you do?
But I would start with your primary care physician and let them know that you're concerned about this. Things that they can start, you want to rule out like that myocarditis or actual heart muscle involvement, like Dr. Ramirez said. So like an ultrasound echocardiogram of your heart, you can get a tilt table test done to see if you have that kind of abnormal response to position changes. Sometimes like a cardiac monitor for a period of time. And I know at least Terry has been through that multiple times, but to look to make sure there's not any actual abnormal heart rhythms. Those are things that you can kind of start with and do to look to see if you have POTS or other kind of similar like vasovagal neurogenic syncope and things like that.
Is POTS curable? We're getting that question over and over again. And Dr. Ramirez, is it curable?
So, the thing to think about with POTS is that traditionally in the traditional POTS, definition, POTS tends to be one that comes through life and hopefully you grow out of it. And that's what we tell a lot of patients, supportive care measures. Sometimes we need to support them with some medications, but a lot of these patients are young and they don't tolerate those medications as well, or they need some sort of blood pressure support. But typically, over time, with the right supportive care measures, you will be able to, reestablish that life that you had previously. But more importantly, we hope that over time you do grow out, okay? Now, if, sometimes you'll have the waves where you'll come out and then you'll go back into it. But at least, with education, just knowing what it's all about, hopefully we can manage those symptoms better if that does happen.
Boy, hopefully everyone who has this grows out of it. I want to bring back in everyone on our panel for some final thoughts from all of you, because this is a fascinating discussion. I want to start with Terry, because Terry, we've talked at length that you have a passion now of trying to reach out to people who still might be hesitant to get a vaccine, and you got COVID before vaccines were available, March of 2020.
Definitely, don't be afraid of the vaccine. Don't be afraid of the booster. get the shot, get the vaccine. The numbers even show that it works. And COVID numbers, people that are getting COVID are people that are unvaccinated. So especially, especially African Americans are in the Black community that are fearful of it. Please just rethink it, consider it and get the vaccine to save lives.
Michaela, talking to you, we've talked a lot about what a relief it was to finally be able to reach doctors in the long haul clinic who validated what you were going through. This has been such a painful journey.
Yeah, it really has. Like we've been talking about, I was young and healthy, and I didn't have any reason to think that I was going to be one of those people that had these longer term issues. And so when I found the team at KU Med who didn't just tell me, oh, you're just anxious or you're just nervous or whatever, I know my body. I know that something wasn't right. And the doctors at KU Med were really the ones who validated that. And were able to continue to find answers for me and give me ideas of solutions, these supportive care measures that we've been talking about that can help, and the physical therapy, et cetera, et cetera. But talking to your doctors about whatever symptoms you're experiencing and advocating for yourself. Obviously, COVID is still a relatively novel virus. We're still learning a lot about it. And if you don't know if what you're experiencing might be related to that, it's worth the conversation with your doctor to try to find some hope and relief. Because even though we're still at that 75%-ish, and we still have these ups and downs and flares, if I didn't know what was going on with me, it would be so much scarier to not have any idea what's happening when my body's having these episodes,
I mean, what a tribute to the doctors here at the University of Kansas Health System to hear what you are saying, Michaela. And I want to touch in with Dr. McCrae. Do you have any thoughts for our viewers or people who are watching right now that might be in the same boat as Terry and Michaela, but have never had any clarity until maybe seeing this episode?
I mean, I think it's important to know that your symptoms are real. I think that a lot of people who are healthy before and suddenly very symptomatic, it's hard for the patient and their family members and their employers to understand that these symptoms are real. And sometimes they're vague and hard to quantify, but there's a huge economic impact and some people can't work. And I know there's a lot of focus on severe disease and death, but I think there's a huge impact on people's lives long term. And so it's not just anxiety. It's not just that you're having a hard time getting better. It's very possible that you have lingering long-term symptoms of COVID. And so don't let, like Michaela said, you know your body, and talk to your doctor. And if you feel like you're still struggling to get answers, ask for referrals.
That's very good advice. Dr. Hawkinson, you've been at this now 2 years, updating the public, talking with our viewers. After this first heart show, what are your final thoughts?
Been at it too long, that's for sure.
Yeah.
But, I want to completely support and endorse our guest messages that we heard today, especially that message about vaccination. I don't think we can endorse the message about vaccination enough. Number one, we know it's safe. Over 1 billion doses have been given. Number two, there continues to be a growing body of quality data to support the fact that the vaccine doesn't only prevent hospitalization, severe disease, and death, but it can reduce your risk of getting long COVID and these long-term symptoms as well. And so I think it's very important to continue to endorse vaccination. Get vaccinated if you are fully vaccinated, meaning your first 2 doses, or if you're immune compromised, your first 3 doses. And then be up to date, meaning get that booster, that 3rd dose if you are immunocompetent, and that 4th dose if you are immune compromised.
Dr. Ramirez.
Yes, I can't echo enough what Dana, Dr. Hawkinson was saying here is that there's a lot of research saying that if you have those patients who had their first vaccine, and then developed COVID afterwards, have a very low likelihood of developing, or a lower likelihood of developing long haul symptoms compared to the majority of patients that developed COVID before the vaccine. Those are the people that tend to have this. Yeah, that we're seeing. But most importantly, I think we just know we're more prepared now than we were before. So before we would have patients that came with these symptoms, we just didn't have the preparedness to provide those resources for them. Dr. McCrae and I work together a lot on patients with POTS syndrome, and the long haul clinics, those things are valuable resources that weren't around when Michaela and Terry both started having their symptoms, or just weren't as integrated yet. And so take advantage of those resources.
How do people get in to see a long haul clinic? Get into that clinic. It's like a club you want to get into when you're feeling so sick. Do they call you? Do they just call the hospital and ask for the long haul doctors? Who do they ask for?
So like Dr. McCrae had mentioned earlier, start with your primary care provider, okay? But also know that if you're not getting answers that at that point in time, there's patients that come directly to me, see me for the first time, and then after I have stabilized things, done the initial workup, I will refer them to Dr. McCrae or that team so that they can continue to work on the long symptoms that they're experiencing.
Such a great team of people here. I do have some really good news I'd like to share as kind of my final thought for today's program. Speaking of our cardio team, we want to give a huge shout out to our cardio team members here at the University of Kansas Health System, because our cardio program was just selected as one of only 15 in the whole country to develop new guidelines for aortic stenosis that health systems across America are going to use. So what is aortic stenosis? Well, aortic stenosis is a deadly and progressive heart valve disease. It happens when the opening of your heart valve narrows, typically with age. More than 1.7 million Americans are living with severe aortic stenosis, and without valve replacement, less than half of those people will live to see another 2 years. The University of Kansas Health System has been specifically selected to create these new national guidelines to help catch aortic stenosis early, find a cure, and save lives. So congratulations to our whole cardio team. It makes us all so proud to work with you, such a smart and talented group of people. Coming up next week on All Things Heart.
It's not always easy when you know that your son is going to pass away and you're going to live on. It's not an easy thing to take in.
A father and son, both in heart failure, only one could survive. We're going to tell you the common symptoms that turned into full-blown heart failure next week. Thank you so much for joining us for our first episode of All Things Heart. We want to remind you that February is Heart Health Month, and heart disease is the #1 killer of women. And in women, that can present like your typical chest pain or even nausea or jaw pain. But before you even get symptoms, cardiologist Dr. Shannon Hoos-Thompson says it is crucial to know your risk factors.
So if you have a history of high blood pressure, if you are a smoker, if you are a diabetic, if you have those other things that set you up for a heart attack, then we need to pay more attention and be more aggressive with recognizing those symptoms.
And again, we want to give a big thank you to Terry and Michaela for taking time to share their health journeys. Dr. McGray, Dr. Ramirez, Dr. Hawkinson, thank you for being here. We would love to see you again next week for our next topic, so be sure to bring your questions and join the discussion on next week's All Things Heart. Thank you so much for joining us this morning for this Best of All Things Heart. We love sharing these important stories with all of you. So remember, you can always email us at allthingsheart@kumc.edu, or you can reach out to us on Facebook, Twitter, and on YouTube. We will be back with live shows focused on all things heart every Thursday morning starting September 8th. Go out and make it a great day.